Hello, my name is Megan Castellanos, and I did my interview with my sister, Haley O'Neill. She is Director of Social Services at the Palms Skilled Nursing Facility, and she mostly works in the rehab wing. She is a BSW and MSW Bachelor's and Master's in Social Work, and I connected with her because she's my sister and one of my greatest inspirations and why I am looking towards a continuing my education in a master's in social work. So her job duties include discharge planning, which she explained as just ensuring that a patient transitions from the skilled nursing facility to home or other healthcare settings. She connects her patients with community resources. She is an advocate for them, especially for the vulnerable and unfunded patients. She does Medicare assessments for billing and reimbursement purposes. She oversees cognitive and behavioral assessments to determine the therapy needs of her patients. And she also coordinates the interdisciplinary meetings between herself, families, nurses, therapists, and physicians. The most fulfilling aspect of her job, as she described to me, was that she is able to provide a sense of emotional support to patients and their families during a very difficult and uncertain time. A lot of her patients are recovering from major medical events, and families often feel overwhelmed during this time. Her patients also sense a sense of culture shock as they enter from the real life world day to day to a inpatient rehabilitation center where they are limited on the things that they can do while they heal. She finds meaning in building relationships with her patients and the families and the clients. Um, she loves helping those families to navigate complex decisions that sometimes require her expertise and counsel. She loves creating those smooth transitions in care and knowing that she made a difference during a vulnerable moment. My sister is a beam of light, and knowing that she loves being a beacon of hope to people that may be facing a dark time, reminding them that it's just a season is definitely accurate. Challenging aspects of her job, immediately she said it was insurance and financial barriers. It absolutely breaks her heart to see a patient who is not receiving the needed amount of care or needed amount of financial assistance because of the way that insurance companies dictate care completely. So if insurance has approved, then they dictate everything about that patient, their stay, how long they are there, how many minutes of therapy they receive, medications, how much of the medication is paid for or not, follow up care, and equipment that they may need to continue healing at home. So, even if a patient needs more help, insurance has the right to deny it. She gave me an example of if a patient came in and had major hip surgery and had not learned to walk yet. If insurance says that their length of stay is over, they have to go home, which puts a lot of stress on them and their families. I asked Haley how she was able to maintain her professional growth in her field of work, considering that she does have a family and a personal life in addition to this. And she talked about how important it is to stay up with licensure, and that is actually essential because policies and the best practices change frequently. She does keep up with her licensure by completing CEU hours each year. That stands for Continuing Education Unit. And she has a strong network of social workers in our area that she stays connected with for peer support and networking purposes. Attending conferences and trainings when her availability allows it is one of her favorite things to do, and I've seen that to be true. And so I was sharing with her what an inspiration she is to me as I consider entering the field of social work. And I was asking her what her recommendations would be for students that are considering this career path. She explained that prioritizing self care is really important because it is a very fast-paced job, and there are a lot of duties and responsibilities, and it can be easy to let yourself slip to the side. But the way she explained it to me was that she needs to be poured into so that she can pour out into her patients and their families. Getting enough rest, exercising an appropriate amount, not overdoing it, eating properly, fueling your body with what it needs to perform, things like that. Basic hygiene, basic mental health maintenance. She also talked about the importance of building strong social skills. Like I said, social ability is a huge part of her job as she bonds and creates relationships with patients and their families, community partnerships, resources, things like that, and communicating with insurance, and all of that requires a level of communication. So being kind, being caring about who you're speaking to, building those relationships personally, you know, and it's more than just a conversation going well. It's really about building those relationships. So she said, if you're someone that is arrogant, you're going to have to humble it down. And if you're someone that's a little insecure, building that confidence in a healthy way is really important. She was very shy before she started this career path, so she forced herself to go to parks and to talk to strangers and to be, you know, just find that relatable ground and to make eye contact and to pay attention and to be assertive when she needed to, but also to have that level of humility. She had a mentor that she used that was someone that was very experienced in the field before Haley was about to enter it. And so that person was someone she could ask questions to without judgment, receive feedback. It helped Haley to keep a teachable spirit. It also just helped her to learn very quickly. And this paid off by her acknowledging that the company she's working for is just as important as the patients and things like that. And so she is a positive beacon of hope to everyone around her. She's a positive partner in her work relationships. She's a positive partner with her patients and their families. And that is because she had someone train her on how to do all of those things. And so, in conclusion, this interview gave me a deeper understanding of what social services in the healthcare environment looks like and how that will play a role in my future if I choose to proceed in this direction. It helped me to appreciate how essential the role of her job duties are in a patient's recovery. I didn't really realize the amount of emotional labor that my sister goes through on a day-to-day basis and how she is able to separate her home and her work and how crucial her relationship with the Lord is through all of this. Meeting people where they are, offering compassion, and helping them navigate systems that feel overwhelming just really reflects her heart of what she does. She really has a passion for it. The way she talked about her challenges, especially the insurance limitations, was just really serious to me. I had no idea that insurance could do that, and so just still building those relationships and providing support even when your heart is broken, being that stable person for your patients and their families is very important. And so I really appreciated what she said about having a teachable spirit, because I think a lot of times we as humans think that we've made it sometimes, and so just remembering that there's always someone that knows something that you don't and that they can teach you. This interview helped me connect my academic learning with real world practices, and it strengthened my desire to serve individuals who are navigating trauma of any kind. And it reminded me the importance of compassion, professionalism, and continued growth. Thank you.